Hey, what's up, YouTube? Here's a new video in English. We're going to be talking about respiratory training. Today, I've been exchanging online with Brian Heap for a little while. He had some questions for me regarding the Breathe Way Better. So I'm just going to splice in his video questions and I'm just going to roll and answer any questions that he had. So without any further ado, I'll let you see the introduction and then we'll jump into the questions.
Hey Sean, how's it going? Brian Heap here. The whole reason for this and that I got in contact with you, I just saw your testimonial just browsing through different websites for the Breathe Way Better device. and just to start there, just from your testimonial, breathing awareness, control, endurance, power, and coordination all will significantly improve. That right there, I think, would solve a ton of people's issues, not only from just an exercise related manner. Uh, I think, and it says in different parts of the on the website, the respiratory system and just the way you breathe. There's a lot of information on it, but I just don't think the public and even a lot of exercise professionals um, know the benefit of it or really understand it and implement breathing into how they teach and how they implement testing protocols, the education that they give out. The breathing is not a big thing that I see kind of publicized. And I think if there's devices out there that can truly help individuals with their breathing, uh, that can really be a big thing to knock some barriers down.
So let me jump in here first. Brian, I think I agree with you. I think that the respiratory system is underappreciated and under-leveraged when it comes to exercise in general. It is a limiting factor for not the majority of people, I would say, but for many people. I'd probably say 10 to 20% of the people that I test seem to come out with, and what I mean by respiratory limitation just means that their breathing restricts them in their physical activities or even in their daily life. And how do I see that? I could have devised advanced testing, but which which I do on the metabolic and the respiratory side, but it's hard to say, okay, this metric means that your breathing is limiting you. So I'm using a very, very simple way to determine that. I ask for RPE at the end of every stage of my step tests, and I ask for 3 RPE values: 1 legs, 1 heart, and 1 breathing. And that forces people to dissociate those kind of feelings, those perceptions of effort, and to tell me, okay, is it the legs or the heart or the breathing that is feeling the most strain? And that alone gives me quite a bit of information as to, okay, if your RPE, your breathing RPE is always 1 or 2 points higher than the rest, and you stop the test and you tell me, well, I couldn't breathe anymore, or my breathing, I lost my coordination and so I had to stop, but my legs were fine, I could have kept going. That tells me that you could probably use some work on your breathing and that it's likely going to improve things dramatically. And even for people who are not directly limited in that way by their breathing, I've seen some significant benefit from developing their respiratory system, even just their awareness of how they breathe. I think it's definitely a big puzzle piece that we usually leave aside wrongly. And so, whether it's with the Breathe Way Better or another device, or with other approaches, there's so many ways of training, of working your respiratory system. I definitely think it's something that people should do more. Let's jump into the questions.
But I did have a few questions here for you. Question one: what are the benefits from training your respiratory system in this way? How does this develop your overall fitness, leading to performance outcomes? And I say that just from your testimonial. Your testimonial again, it gets me thinking and having clients becoming more aware of the coordination aspect of breathing instead of a more capacity related way.
For me, the main benefit is improving the control of how you breathe. I think there is some literature showing that there are positive effects on performance directly from respiratory training. And I definitely think that this can be the case and that it is the case. But I also currently don't have any very controlled way of determining that, of saying, okay, you did this respiratory training, this happened, hence performance outcome. So I'm quite cautious in linking the respiratory training directly to performance outcomes. I do think, however, that simply better controlling your breathing will help you lower your rating of perceived exertion at a given intensity. And so if by nothing else than just breathing slower and being in more control, we know that respiratory frequency is coupled to our rating of perceived exertion. Essentially, the faster you breathe, the harder it feels. And we know from the work, for example, of Alex Hutchinson in his book Endure, that our perception is our reality. So what we perceive is what our body knows to be true. And in that sense, if you feel like you're working hard, then it's probably hard. And if you feel like you're not working that hard, then it probably feels a little bit easier, and that's true. And from a brain standpoint, if it feels easier, that's a good thing, because it's likely going to give you a little bit of headroom to push a little bit longer or push a little bit harder. So that's where I see this respiratory training being the most interesting. That being said, something that I have seen consistently, and I don't know if I would call that a performance outcome per se. I guess you could call it a performance outcome. A significant lowering of heart rate for a given power output. And that's been the most apparent on running. Most people that have done the training program with the Breathe Way Better have shown 5 to 10 beats less or lower heart rates for a given running pace or running speed after 6 to 10 weeks of training. And that is significant. And that's obviously not going to, happen again and again and again if you keep repeating the program, and you're not going to end up dropping your heart rate 30 beats at a given intensity. But that's something that I've heard consistently, and it makes sense because in running, we know that the diaphragm plays a significant stabilizing role on the spine. One of the main roles of the diaphragm is obviously to breathe, but also to stabilize your spine. And if you have better control, better excursion of your diaphragm, better range of motion, it does make sense that it would obviously make the running motion feel easier and also lower the load in general, and just make this work easier for your body. And that's something that I've seen. Mechanistically, I don't know exactly why the heart rate drops so much and so quickly following respiratory training for runners specifically, but that's something that I've seen anecdotally. I've seen it on the bike as well, but it's maybe not as pronounced. It's not 10 beats per minute. It might be 5 beats per minute that are at a given power output. That's still significant. And so that's where I would kind of draw the line for myself, is can you get some performance improvements from respiratory training? I think you definitely can, but I also think that the coordination aspect is more of a function versus structure kind of adaptation. So how you use your breathing, and obviously that can change pretty quickly. So those gains will be short term. They'll have a positive impact long term, but they'll be short term. Now, if you talk about developing the endurance of your diaphragm, those kind of adaptations, now you're talking about changing structures, and that will take months, if not years. And that's what you see with Luke Way's triathletes who've been doing Breathe Way for years now, and who have tremendous performance when it comes to respiratory performance, or capacity, or ability to use their respiratory system to leverage it for performance. But that's something that's going to take months, if not years, to develop. So I think you can have some short-term gains on the function side of things, which already is going to make a big difference for a lot of people, especially people that are limited by their respiratory system in general. And then you have the structural adaptations, which are going to take months and years. And this is, to my knowledge, this is not documented yet.
Question 2, is the device easy to use? And I mean that by, is there any clunkiness or awkwardness to using the device? Can somebody bring it with them to their personal training session easily? Is it easily kind of portable?
I just leaned over and pulled that out of my backpack, so it's a little dusty, but it's super easy to take into your bag. It's literally a silicone bag, as you can see. I can't see my screen, so I don't see what you see here. Yeah, it's a silicone bag, and it's a little three-way piece and a mouthpiece. That's as simple as it gets, as opposed to the competitors that are no longer on the market, from what I understand. That also did isocapnic devices, which were very clunky and very complicated to use. This is as simple as it gets. You fill up the, I like to start by filling up the bag and then breathing from a full bag. So essentially to start, you just so that's how easy it is to use. And when it comes to learning how to use it, I think that it's not a limitation of the device, but it's something that we have to consider is optimal coordination of breathing. There's obviously not one way to breathe, but there's definitely an optimal way to learn how to breathe at first. Essentially learn the rules and then learn to break the rules later. I think that's a useful framework to build. And so obviously you can definitely use the device and breathe in a suboptimal way. What I would mean is, for example, breathing in with a big trap contraction, a lot of pec, a lot of thoracic elevation, as opposed to pulling down with your diaphragm, trying to, and I think when I took my first breath to blow into the bag, I lifted my shoulders a little bit, and I noticed that on the video. So I corrected that on the subsequent cycles, but essentially trying to minimize, let's say, anything that's above the diaphragm from moving too much when you learn how to breathe with the breather better. So really pulling your diaphragm down, trying to expand posteriorly, so trying to fill your back with air is a useful cue. Sometimes I use a band. So it's very easy to use, but you can definitely use it. And I don't want to say wrong, because again, there's no wrong way of breathing, but you see what I'm getting at. So I would emphasize the technique of breathing, especially in the first sessions, first weeks, to make sure people learn how to really leverage the diaphragm, learn how to breathe in, learn how to exhale. There's some really useful exercises that I found there's a book called Awareness Through Movement by Moshe Feldenkrais, which is fantastic. It's phenomenal. And there's lots of little awareness breathing exercises that can be done just lying on the floor, no equipment needed. And that's, I think, a great place to start for most people. And then integrating that awareness and that control with the Breathe Way Better. But it's as easy to use as any other device, in my opinion.
Question 3, are there practices that somebody can do outside of owning or even using this device that bring about the same or similar results? Are there other breathing exercises that you can do?
So I hadn't rewatched the video recently, so I kind of answered that question. I think there's lots of exercises that can be done without the device or in parallel to using the device. Moshe Feldenkrais, Awareness to Movement, that's a great book. I think The Oxygen Advantage from Patrick McEwen has a lot of good insights as well. He's a little hell-bent on the nose breathing and the CO2 side of things. I'm in line with what he has to say. I might not just be as excited as him about the general effects that it can have on the body, although I do think it's beneficial and positive for many people. I think Wim Hof's book is great for people who want to explore their breathing. I know there's a Buteyko method, which is somewhat used in Patrick McEwen's book. There's James Nestor's breath which is a fantastic book that outlines a lot of different respiratory practices in general. I think those are all very complementary. I think it's worth exploring for somebody who's curious or somebody who needs more control and awareness of their breathing. I, however, think that the device does provide some valuable resistance, not in the way of load, but in the way of feedback. Because when you have the bag, you can see if you're filling up and emptying the bag properly, or if you're falling a little bit short on the inhale or the exhale, maybe both. And so I think it's a valuable tool to give you that feedback when you're breathing. It's also a really good way to work breathing in different ways. I like to use tempos, so different counts on the inhale and the exhale. If you want to, for example, emphasize the exhale aspect, you might inhale on 3, exhale on 1. So force yourself to exhale really fast, all the air that you breathed in previously. You can work with frequency ladders. You can work at high frequencies, low frequencies, and or cadence, and that's really valuable to enhance coordination. And you can't really hyperventilate at a fast rate without a breatheway or a device that allows you to remain isocapnic. Isocapnic meaning keeping your CO2 levels normal or where they were before you started breathing that way. Because same thing as when you breathe on a fire. When you blow on a fire, your head's gonna start spinning after 20 seconds because your CO2 levels are low because you were hyperventilating relative to your level of effort. We produce CO2 as we do mechanical cellular work. The more you do, the more CO2 you produce, the more your brain tells you to increase your ventilation in order to get rid of that CO2, right? We don't breathe more because we're lacking oxygen. We breathe more because we're accumulating more CO2. But if you're at rest and you're breathing hard, now you're not producing more CO2, but you're breathing too much, quote unquote. And so your CO2 levels drop, and that's where your head starts to hurt. So you couldn't really train those aspects in an optimal way without a device like the Breatheway. So yes, there's lots of ways to train your breathing without the device. And I think that starting with being aware of your breathing and controlling the motion of breathing, full exertion of your diaphragm, knowing how to dissociate diaphragmatic versus thoracic breathing, all those things are very, very important and are prerequisites to using the device in an optimal way, in my opinion. But then it does offer some unique ways to train your respiratory system that I don't think you can attain without.
And then question 4, do you personally own the device? If so, how do you implement it in your own testing and assessment process? And then if not, are you planning to bring one on?
So as you saw before, I do own the device and I use it sporadically myself currently because I'm not in a training phase. I'm in a heavy work phase. I have a lot of work to do. So I'm very much on a maintenance phase on the training side. So I do use it sporadically myself. I implement it mainly, I don't implement it in the testing process, not yet, at least. It might be something that I do down the line, but for now, that's not something I've thought about, but you might have given me a really good idea, Brian. So I appreciate you for that. I'll be thinking about that in the next few hours and days. It might be an interesting device to use for some assessment and simply putting someone through a respiratory ladder, which I use in one of my respiratory programs. Start at 15 breaths a minute, coordinate that properly with optimal volume and technique and breathing technique or breathing mechanics for a minute. And then you go up 3 breaths a minute and you keep going up, and you go as far as you can. When you can't hold the volume anymore, or when you can't hold the coordination, or when your technique goes out the window, you stop, and that's your reference point. And you can always test that again down the line to see how things improve. That's something that I use in the program. That's something that, now that you say it, I might start implementing in my testing. Very good idea, Brian. And then otherwise, for my athletes, I implement it as regular training throughout the week. They also really like to use it in their warm-ups. I work with some CrossFit athletes, and they like to use it before their competition events. So they do their general warm-up, they do the specific warm-up, and then they do their respiratory warm-up, and then they're ready to go out and throw down. Because usually you don't, it's unlike a long endurance event, although it would still be, in my opinion, optimal or beneficial to train or to warm up your respiratory system before an endurance event. It would still be interesting, but it's even more important and interesting when your event is really short. Because if you only have a 5-minute workout ahead of you and it's an all-out type of effort, you want to be in there with all lights on from the first second. And if you didn't warm up your respiratory system optimally, you might be falling a little bit short of your potential on that test. So my CrossFit athletes use the Breatheway, I almost want to say religiously, in their warm-up pre-competition, because they really feel the difference that it makes for them, in addition to just the general coordination work that they do throughout the week.
So those are the questions that I had. If you want to answer all 4 of those, that would be great. But yeah, I'd love to just kind of get some feedback on how you have used it personally, and if you've seen any progress with your clients personally. It'd be really great to know. But yeah, I appreciate it, and best of luck going forward. Thanks.
All right, Brian, I hope I answered all your questions. And to your last question, I have seen some significant positive effects from the Breatheway Better on my clients that I work with one-on-one, with the people that have just taken my training program with the device and run through it. And I definitely think the coordination side is the main aspect that is of interest for most people. And obviously then the performance side for those that are targeting those kind of developments. But here you go. Thanks, Brian, for your questions. I hope my answers were helpful. And if you have any follow-ups, you know where to find me.